Now let's get the very latest from eNCA's Moloko Moloto, who now finds himself at Baragwanath Hospital in Soweto. You've moved away from Charlotte Maxeke Hospital, which really was the center focus over the last, especially 24 hours or so. Moloko, what's the situation in Soweto?
Hello, Marcel. Well, we are at the Chris Hani Baragwanath Hospital, one of the largest hospitals in the country, if not in the southern hemisphere. And maybe if I were to step out of shot, you possibly can see that the gates are open. And since I've been here, I could see cars driving in and out of the hospital. Along the Chris Hani Road, the main road that is passing before the hospital, there are some rocks that are placed on the road. Motorists are made to navigate as they come towards the direction of Maponya Mall. But as Teddy will show you, there are a few members of Nehau, as you can see there, just on the next to the entrance. And you can see that there was burning of tires on the tarred road leading into the hospital gate. Rubbish strewn all over. It seems somebody has tried to clean. Not only here, but also to Teddy's right, you can see rubbish there. But if Teddy can show you up there, there are people who are on that particular bridge, which is linking Bara Hospital with the taxi rank. People are seemingly walking in and out of the hospital. There doesn't seem to be any disruption at this point in time. There are a few members of Nehau who are also gathered there. But we understand that Bara Hospital, since the strike started, is one of the hospitals that were hit hard by this particular strike. And we understand as well that earlier today there was a shootout. Police were made to fire rubber bullets to disperse the workers who were here. Let's bring in the workers themselves. They are representatives. Dennis Njali is the branch secretary of Nehau here at Bara. Dennis, I'm told that the police shot at some of your members earlier. Apparently you were refusing members or who are not on strike and the members of the community from going in. Is it true? Were you shot at?
Thank you very much, comrade. First of all, I must say we've been having demonstrations for the past 2 days, and it was very peaceful because we believe that we are fighting not only for us, but even for the other people who are out there. But now, today, something strange happened. A new group of police that was not there for the past 2 days. They just came here, they started shooting to a point that even the CEO came to try and stop them. They just couldn't take a word from the CEO. They couldn't take a word even from the HOD of Labor Relations. Can you just imagine so much hostility coming from our brothers who are supposed to be with us in what we are fighting for? It was so bad in such a way that even when people were dispersed, they were shooting people across the streets. They were shooting randomly, just like trigger friendly.
Where are your members who were shot at currently?
Yeah, actually.
How many of them as well?
Yeah, actually we have about 11 of our members who were shot, who are wounded. Some of them are still at casualty. One of them is actually on resus as we speak.
So they are inside Chris Hani Baragwanath Hospital receiving medical attention. Do you not see the irony there? Your members, as Nehau, are on strike, denying ordinary South African an opportunity to have access to medical care. Yet when you are in trouble, when you need medical attention, you are being attended to. That's hypocrisy, somebody will say.
Thanks for also asking that question, because we need to make sure that we clarify such things. When we were here, the 2 gates that you see on the other side, we arranged that they remain open so that those who are coming in or going out can still have access. But at the same time, we want to make sure that our voice is heard. So that was an arrangement we've had even for the past 2 days. But all of a sudden, this kind of hostility, we believe that we are no longer in the apartheid system. But what happened today I can't even describe it.
What message would you give then to somebody who has no alternative? They can't go to private medical hospitals. This is where they must come, or any other public hospital. Yet your members, the striking members of NEHAWU, perhaps your demands are legitimate, but if they are stopped from accessing this, what do you say to such people who may even die? Do you even care about them?
Remember, we are healthcare professionals ourselves. We may be wearing a uniform right now, but we believe that a patient comes first. If actually we didn't think of that, we wouldn't have even allowed anyone to come in. But we've been escorting even our ambulances because we believe that you cannot keep an ambulance outside because it's an emergency. So with all that in place, we were hoping that the very same police will also meet us halfway.
Mjali, I see there were tires that were bent here. Yeah. I presume they were bent by yourselves as the protesting workers. Somebody who sees burning tires and they are sick, these tires burning in front of the entrance of the hospital, how do you expect such a person to walk towards the fires, even if you call that protest peaceful?
Okay, when it comes to tires, I don't think I can be able to answer to that because different things happen. They say sometimes during war there are some casualties, so there are some things that we cannot really explain. But the main thing here is that we also want, and we are happy that a few days back, 2 days ago, even the community joined in because they understood our struggles. First of all, you cannot be having one person who's supposed to be covering for 5 individuals, but we are not getting people hired so that we have enough staffing to deal or to even serve the very same community. That's one. 2, if we are getting 3%, this 3% is not something that we even bargained for, which means, in other words, you are taking away the right for collective bargaining. And if that's the case, which means going forward, the employer is just imposing this on us without us coming on board.
I'm sure a lot of South Africans will relate with the challenges that are facing the public healthcare sector. Shortage of equipment, staff shortage, and all those that you are listing, including the fact that you possibly are not paid the same way your colleagues in the private sector are being paid. But if you are withdrawing your labor, the very same people who ought to use these particular services can't access them. How is that assisting them?
As I said before, that we have even made a compromise. If we had blocked everything, then you wouldn't be seeing even these cars coming in here. The fact that they are coming in is already a compromise on our side because we want our voice to be heard, but at the same time we are saying, no, let's allow those emergency cases to still be attended.
Let's conclude. The Minister of Health, Dr. Joe Phaahla, told us a short while ago that across the country, as of this morning, a total of 4 people died in hospitals as a result of the implications of this particular strike. You as health care workers are supposed to be saving lives. How far are you prepared to go in ensuring that you carry on with your strike until your demands are heard, given the fact that people who are vulnerable have nowhere else to go?
Actually, right now, I want to believe that the community is beginning to understand that they are supposed to also be here to assist us instead of us working in silos or in isolation, because you cannot have a worker who's in isolation. The same worker is having a family. That family is a family within the structure called community. So because of that, we believe that we are actually fighting for the same thing. My wish, not just a wish, I'm hoping that by as soon as possible, the employer should have responded before we...
Here's a very last question. I counted about less than 20 people that I see outside who are wearing NEHAWU regalia. And I'm told that you as NEHAWU are the majority union here. Surely these numbers are less. Is my assessment that, considering that people are going in and out of hospital, perhaps your strike, if you were to remove the intimidations and violence, put them aside, your strike perhaps is not as effective as you had wanted it to be?
Okay, I will tend to differ. It's unfortunate that you guys only came now. In the morning, it was a different situation from what you see here. So definitely, even when you check with other branches and other institutions, you'll see that the effect is already felt. Actually...
What is that impact?
The impact is that people are showing how angry are they to this arrogant employer that we have, that is not willing to put us on board and negotiate, instead impose things on us.
Dennis Njali, the branch secretary for Nehawu at the Chris Hani Baragwanath Hospital. And at this point in time, we know that the MEC of Health, Nomantu Ngomo Ralehoko in Gauteng, will be coming here. I don't know exactly what to do. Is she going to be able to convince these workers? We wait to see. She will also go to Bheki Mlangeni. Ironically, Marcel, we heard that at the Bheki Mlangeni hospital, also here in Soweto, a police station is not very far from that hospital. Yet police were sitting idle, not intervening, despite the fact that they have a responsibility to ensure that there's law and order, and people were apparently being turned away. Now, the police's top brass, the district commissioner here in Johannesburg, Major General Max Marsha, when I asked why did they fail to intervene, he said, look, we'll investigate, we'll make sure that people who didn't do their job are held accountable. But as matters stand, they seemed to have acted only after the provincial government of Gauteng secured a court order compelling them as the police to ensure that they do their work.